I'm Beverly Kirk with the Global Health Policy Center, here with Dr. Nafsiah Mboi. She's the Minister for Health for Indonesia and also the chair of the board of the Global Fund to fight AIDS, tuberculosis, and malaria. And thank you so much for being here with us.
Thank you. It's a pleasure.
You recently assumed the title or the position of chair of the board of the Global Fund. Congratulations. What do you see as the main challenges facing the Global Fund that it's going to have to address?
Well, the board just approved the new funding model, and I think for the Global Fund, for the board, the challenge is, first of all, how do we defeat the 3 diseases in each country, okay? In partnership with the country, with the new approach that the ownership is in the hands of the country. Second is, how do we provide the support to the executive director and the secretariat to be able to work, to do their job in a transparent, accountable way. And the third, I think a big challenge is, how do we ensure that to get the biggest impact at country level for whatever we are doing, and for the money that is invested in each country. I think that is the real challenge. An interesting one, but it is a challenge.
You're here in Washington for the Global Fund's 3-year replenishment, and you mentioned the new funding model. How are donors feeling about the Global Fund?
So far, I think it has been positive, quite positive actually. People were very happy about the change in the whole structure, the secretariat, even the approaches. Many donors are quite happy with the new funding model, and I think because in the board we have people from the donor as well as the implementer side, it's very good because you can have dialogue there. And I think that's very advantageous, to be able to know each other and say, okay, how does it look from this perspective, and how about from the other one's perspective? But so far, I think the donors have been quite impressed with the changes in the last few years.
We mentioned a couple of times the new funding model, and most people who are going to be watching this know what that is. But for those who maybe don't, can you give just a brief description of the new funding model?
Okay, let me speak from my experience. Okay, we started receiving support from the Global Fund, and at that time, from our perspective, it is as if the Global Fund was a donor. And we sometimes hate it because they would say you have to do this, you have to do that, and you have to do this. But I think that changed over time. What we have seen is that there is real partnership. In the new funding model, it's the country that has their own strategy and action plan, and then the country decides, this is what we're going to do, this is what we're going to achieve. And then the funding to reach that can come from the government, can come from other donors, but also Global Fund is the partner, yeah.
In essence, the country has more of a say in how the funding is spent.
The ownership is still with the country.
You mentioned tension, so we're going to delve into that. You're the health minister. You're the health minister for a large middle-income country. So, as you alluded to, you're familiar with the tension that can sometimes arise with donors who are saying, you know, these countries, they're doing better, they can contribute more. In terms of financing some of the services. What do you say to donors now that you're in the position of being chair of the board of the Global Fund?
Yeah, I would say I understand. I understand because donors should feel that this is what they do to jumpstart, let's say, the activities in country, but then at one moment the countries themselves will be self-reliant. So what? Then your next question will be, then what do you ask from the donors, right? Right. You know, that whole middle income thing, that's for the birds. I mean, the World Bank suddenly tells us that we are middle income. But for me, in the health sector, doesn't make a difference, because you still have to go through the whole process of health development. And economic development and health development do not necessarily jump at the same time, right? And I keep telling our parliament and our parliament that, look, my task is for people to try, at least, that people stay healthy so that they can be productive, and that will produce economic development. But if you say, oh, we're middle income and stop everything, that's for the birds, right?
President Obama, who obviously has ties to Indonesia, he spent part of his childhood there, he announced the strategic pivot to Asia, and the U.S. has partnered with a number of countries to work on the Lower Mekong Initiative. How do you see the U.S. playing a role in Asia on urgent health issues like those that the Global Fund addresses?
United States will bring, or has brought, not only funds, but the whole technical skill, the whole way of working, and also that whole involvement of the private sector and philanthropy, which is not developed so much in our countries. I think because the United States is used to that, we have learned a lot from that. Okay, so that that whole it's a whole new approach for us, the private sector and philanthropy, etc. And that is, I think, it's very good to learn from the United States.
All right, Dr. Nafsiah Mboi, thank you so much. Pleasure to have you here with us.
You're welcome.